Hey everyone, this is Kevin Soriano from Cross County Cardiology. Welcome to Whiteboard Wednesdays. Today we're going to be talking about coronary artery disease and what happens to your blood vessels when you get plaque buildup. The coronary arteries are the arteries of the heart. There are 3 coronary arteries that we talk about in heart disease. Okay, that is the left circumflex, which is a artery that goes to the left side of the heart, the LAD, which is the big artery that goes down the front of the heart, oftentimes called the Widowmaker, and then an artery to the right side of the heart called the RCA. Any of these arteries can be involved in coronary artery disease, but typically the process and the symptoms are all the same. So when we have coronary artery disease, what happens is that the normal healthy vessel has a nice thin wall to it. Okay, over time, from a number of things like high blood pressure, diabetes, or cholesterol, plaque starts to form in these walls. As this process goes on, more and more and more of the vessel gets blocked by this plaque, impeding blood flow to the heart muscle itself. Okay, and patients typically feel this as what we call angina. So those are the symptoms like chest pain, shortness of breath, and exertional fatigue, or fatigue when you would normally otherwise be able to do something. All of a sudden, you're not able to do that. So over time, this happens. Usually, you start to feel symptoms when 70% of the area of this vessel gets blocked off. Anything less than that is unlikely to cause symptoms. How do we treat this? First of all, the name of the game is preventing this. So this is why you come see us. We get you on all your right blood pressure medicines, keep your cholesterol low with medications and diet, and exercise, okay? But inevitably, this happens to people, okay? So we treat this with medications, anti-anginals, okay, that will put you on if you have this problem. And if it gets bad enough or you're still having symptoms, we can put in stents. We look at the vessel this way. When you have a blockage that forms, we put a stent in. We use a small wire, okay? We inflate a balloon right here in the vessel, and that pushes all this plaque over to the side of the wall, okay? So at the end of that ballooning process, we have a nice open vessel, all right? And then to keep that there, we put in a stent, which is like a metal scaffold, okay? That puts the plaque up against the wall and keeps it there. And so now you have nice, easy blood flow through the vessels. All right. So again, in summary, coronary artery disease happens to almost everyone. All right. It's driven by things like diabetes, high blood pressure, high cholesterol. Over time, you might start to feel symptoms, things like chest pain, shortness of breath, or exertional fatigue. And there are multiple treatments. The name of the game, of course, is preventing this. But after that, we can put you on medications or do a procedure like a stent to make you feel better. So thanks for joining us for Whiteboard Wednesdays. We'll see you next week.